You feel on edge all the time. Your mind won't slow down. You can't finish what you start. You forget things. You overthink everything. So you assume it's anxiety. You try therapy, maybe medication, maybe both, and it helps a little, but something still feels off. Here's what most people never find out. What if anxiety isn't the condition? What if it's the consequence? Let's talk about how ADHD can look like anxiety and why treating the wrong one can keep you stuck for years. I'm Dr. Air, quadruple board-certified psychiatrist and anxiety expert. I've treated thousands of people struggling with anxiety, and a common thing I see in my clinic is this. Someone has been treated for anxiety for years, multiple medications and therapy, but only partial relief, still struggling. And when we look deeper, it's ADHD driving the anxiety. Now, here's what most people get wrong about ADHD. They think it's just a focus problem. But ADHD is actually a brain regulation problem. And when your brain can't regulate itself, when it can't filter, prioritize, or settle, it creates chaos. And that chaos can feel like anxiety. Think about it this way. Imagine your brain is an air traffic control tower. With ADHD, every plane is trying to land at the same time. No order, no sequence, just noise. Your nervous system reads that noise as a threat, and it responds the only way it knows how, with alarm. That alarm, that's what you've been calling anxiety. Sometimes anxiety isn't the condition, it's the consequence. So why does ADHD look so much like anxiety? Because the symptoms overlap almost perfectly. Racing thoughts, restlessness, trouble relaxing, constant overwhelm, sleep problems, irritability, difficulty concentrating. These are textbook anxiety symptoms, but they're also textbook ADHD symptoms. This is why so many people get misdiagnosed or partially diagnosed and spend years treating only half the problem. Studies show that anxiety disorders affect 20 to 50% of people with ADHD, 3 times higher than the general population. Now, how do you tell the difference? Hold that thought. I'll come back to that in a few minutes because the answer might surprise you. But first, let me walk you through 5 hidden ways ADHD creates anxiety. Number 1, overwhelm becomes an anxiety signal. With ADHD, the brain struggles to prioritize. Everything feels equally urgent. The email, the deadline, the bill you forgot, the text you haven't answered. When everything feels urgent, nothing gets done. And when nothing gets done, your nervous system shifts into stress mode. Your body doesn't know the difference between a real threat and a to-do list that's out of control. It responds the same way, leaving you feeling stressed and anxious. That's not anxiety disorder. That's an overwhelmed ADHD brain triggering your stress response. Number 2, the always behind feeling. People with ADHD often carry quiet, constant guilt. Missed deadlines, forgotten appointments, unfinished projects. Over time, that guilt turns to fear. Fear of dropping the ball again, fear of disappointing people, fear of what happens if you can't keep up. And fear, sustained long enough, becomes anxiety. This becomes more common as we get older. The stakes get higher, the responsibilities pile up, and the margin for error shrinks. Number 3, emotional dysregulation. Here's one most people don't know about ADHD. It doesn't just affect focus, it affects emotional control. A small frustration can feel like a crisis. A minor setback can spiral into a panic. A critical moment can land like a punch. The ADHD brain has a harder time putting the brakes on emotional reactions. And when your emotions feel that intense, that unpredictable, it feels exactly like anxiety. Now let's talk about how a brain chemical ties all of this together, because this is where it gets really interesting. Number 4, dopamine imbalance. Your brain uses dopamine to help you focus, feel motivated, and sense rewards. With ADHD, dopamine signals get mixed up. The brain doesn't release it at the right times or in the right amounts. This makes your brain constantly search and seek. It can't settle down or stay focused. That restless, can't sit still, mind won't quiet feeling, that's your brain hunting for something to grab onto. This can feel a lot like anxiety, both to you and to others around you. Number 5, sleep disruption. ADHD brains are wired to stay active late. racing thoughts at night, difficulty winding down, lying in bed while your mind replays the day, plans tomorrow, and somehow also thinks about something that happened 5 years ago. One study found that about 6 out of 10 teens with ADHD are natural night owls. They also have more trouble falling asleep. Poor sleep makes ADHD worse, and worse ADHD makes anxiety worse, and worse anxiety makes sleep harder. It's a loop, and most people are stuck in it without knowing why. Just like it was with a patient I'll call Michael. He came to me after years of treatment for anxiety. He had tried multiple medications, he had done therapy, had made lifestyle changes. Things improved, but never enough. Something always felt unresolved. When I sat with him and really listened, the picture became clear. The anxiety was real, but it wasn't the root. The root was ADHD, undiagnosed, unaddressed, and quietly driving everything. When we treated the ADHD, the anxiety that had been there for years reduced because we finally addressed what was causing it. Now let's talk about medication, because this is where things get nuanced and where many people get confused. Stimulant medications like Adderall and Vyvanse can be incredibly effective for ADHD. When they work well, something remarkable happens. Focus improves, overwhelm decreases, the mental chaos quiets, and when the chaos quiets, anxiety goes down. Not because the medication treats anxiety directly, but because it treats the dysregulation that was creating the anxiety. But here's what most people aren't told. Stimulants can also worsen anxiety, especially if the dose is too high. The nervous system is already in overdrive, sleep is poor, or caffeine is stacked on top. When that happens, you get increased heart rate, jitteriness, and a feeling of being wired and wound up. This medication-induced anxiety may go away with time, but in some cases, the medication will need to be changed. So how do you know if ADHD might be driving your anxiety? Ask yourself these questions honestly. Does your anxiety spike when you feel overwhelmed or disorganized, rather than in response to a specific fear? Do you struggle more with starting tasks? Does having structure, a clear plan, a routine, a deadline actually reduce your anxiety? Did you struggle with forgetfulness, poor concentration, and hyperactivity as a child? If you answered yes to those questions, ADHD may be a significant part of your picture. This doesn't mean you don't have anxiety. You might have both. Many people do. But it means the anxiety may not be the starting point. It may be the symptom of something deeper. And that changes everything about how you treat it. Here's what I tell every patient in this situation. You don't treat the label. You treat the system. 3 pillars. First, brain support. If ADHD is present, address it directly. That might mean medication like Adderall, Vyvanse, or Concerta. It might also mean non-stimulant options like Strattera or Wellbutrin. Second, lifestyle. Sleep is non-negotiable. Movement helps regulate dopamine naturally. Protein at every meal stabilizes blood sugar and supports neurotransmitter production. Cutting back on caffeine, especially afternoon, can make a significant difference. Third, nervous system regulation. You can't think your way out of a dysregulated nervous system. You have to signal safety to your body. Coherent breathing, 5 counts in, 5 counts out. Morning sunlight, short walks after meals. These aren't trends, they're resets. When you stack these 3 pillars together, the brain has what it needs to regulate itself. Medication works better, anxiety reduces. And to find out exactly how to navigate this lifestyle treatment and reduce your anxiety, watch this next video.